your son's having some focus issues or concentration, or the teachers are saying that he's misbehaving, or like he has trouble sitting still, and you're wondering if he has ADHD. Okay, well, you've come to the right place. So my name's Agam Dewan. I'm a child, adolescent, and adult psychiatrist. And so it's my job to help out moms help their sons with their mental health. So ADHD, the first question that people have is it real? And so it's definitely a real thing, but oftentimes a lot of it gets misdiagnosed or it can get missed. So what we're going to do today is we're going to go through all the signs and symptoms of it so you can have a better idea of whether or not your son or child has ADHD and what to do to get treatment. So let me share a story with you. So I had this 12-year-old kid, and everyone just thought that he was a bad kid, and he was being willfully angry and aggressive, and he would get mad a lot. He would throw tantrums. He had trouble sitting still in class. Teachers would say that he barely did any homework. And when we assessed the kid, like, he had clear signs of ADHD that had been going on rampant because the family wasn't really a mental health family, if that makes sense. And we started the kid on treatment. Literally like a month later, the family was like, holy crap, our kid is completely better. Like, he's behaving much better in school. We're not getting complaints from the teachers. Like, this is such a profound change. We're shocked at where this came from. So that's the power that treating ADHD can have. So we're going to go through the criteria for it. The index that we use is called the DSM-5 to make diagnoses. And there's two different splits of it. One is the inattentive type of ADHD, and the other is called hyperactive. And then people have /impulsive. And then some people have one where it's combined. So the inattentive type, here are some of the symptoms that are associated. Not paying attention to close details, having trouble staying on attention on tasks. They don't listen when they're spoken to directly. Their mind wanders a lot. They have organizational issues. They might struggle with following through instructions, for example. They might have difficulty organizing stuff like tasks and chores and homework. Like, for example, you could tell them to clean their room, and they might clean like their dresser, then they go to their bed, then they go to their computer room, then they go to their laundry, and they bounce around doing a little bit instead of doing everything like one at a time methodically to make sure that it is clean. Or you might tell them like, hey, go to aisle 5 to pick up this thing, and then go to aisle 6 to pick up that thing. And then they might get to aisle 5, but then completely forget about aisle 6. They avoid stuff that requires sustained effort. This can include like homework, for example, right? Or certain classes. For example, I remember I had a patient who was really like into his math and science classes, but then when creative writing class came around, like, it was the biggest chore for him. You often also hear that kids will, he doesn't have ADHD because he hyper focuses on video games. Well, that's because video games are very, very easy to focus on. The reason is because they're very high stimulatory. So they provide the stimulus that the brain needs so it doesn't have to do any work. Whereas homework or reading doesn't provide that stimulus, so you have to do the work. They might lose stuff frequently. So like, keys and toys and homework and like other important things, USB sticks, their phone, that type of thing. They get distracted a lot by external stimuli. So, they could be talking to you, but then, they're looking over there, then they're looking over there, then, this thing happens, and then, this thing happens. So this is often something I see in a lot of women and girls. And so they're often undiagnosed with ADHD because like they don't have the hyperactive type. They have more of this distracted type. And I see it a lot. So I live in New York, having a young social single life. So I interact with some, women in the scene here. And more often than not, like, they get very distracted. I've noticed more than guys. Guys have more the hyperactive type. And, when we just start chatting, like, a lot of them like, yeah, I have big ADHD. But that's a separate topic. And forgetful in daily activities. So they might miss appointments, they might forget their homework, miss deadlines, checklists, they might forget, unless it's like explicitly there. So all of those lead to the inattentive type. And, so you have to have those, at least 6 of them, for at least 6 months and in like multiple areas. So it's not just at school or in one class, but like it's like a pervasive pattern throughout. And ideally, it has to start before age 12 to make it super definitive. So that's the inattentive type. And then the other one is the hyperactive type. And so the hyperactive type, that's where you have more like fidgeting or squirming. They might leave their seat a lot when they're expected to sit down, for example, like class or dinner. They might run around a lot, might climb more inappropriately, just like way more. Like, for example, in my office, I'll have kids come in and they'll like sit on the couch for 5 minutes, then or like 2 minutes, then they'll go check out my bookshelf, then they'll start playing with my toys, then they'll like lay down on the floor, and then they'll stand up. I remember I had one kid who paced the office like maybe twice and said hi to all the staff members. So that's the thing. Oftentimes it's hard for them to play quietly, so they might move around a lot, they might make a bunch of noise. And, you might say like, oh, this is just boys being boys, right? Like, don't pathologize boys. And, obviously to some part I agree. But the most important thing is that it's impacting functioning, right? So in this world, we're expected to be good in school, go to college, get a job, be able to hold a job, meet deadlines. Like, there's expectations on us. Even if you're an entrepreneur, right? There's usually expectations in your business. And so it can cause significant distress in your life if that happens. For example, I remember I had this 35-year-old guy, and he says that he's an entrepreneur, right? He's diagnosed with ADHD, so we're treating him. And for him, his thing was that, his mind would just wander, like he would just be wandering like crazy. And he's like, tasks that I think should take maybe 30 minutes to an hour take like 4 hours. And yeah, we started him on Adderall, and he's like, wow, like when I save it for the tasks I need it the most, I can be so much more productive in my business. That has implications, right? Like, that's money that he's losing out on because he's losing productivity. ADHD kids often will talk a lot, like they'll talk excessively. They can't stop talking. They'll just chatter on and on and on unless you interrupt them. They might blurt out answers or things before like the question is done, right? It's that impulsivity. So it's not just physical impulsivity, but like that verbal impulsivity too. And it comes from a decrease in the frontal lobe function. Your frontal lobe is the CEO of the brain. It does all the control. If that isn't functioning properly, then you are more impulsive to your emotional brain. It might be hard for him to take turns. It might be hard for him to wait in lines, that kind of thing. And he often will intrude on others or interrupt other people too. So all of those are signs of hyperactive and impulsive type of ADHD. And so another thing to note with all that is that these are generally occurring like in multiple settings, as I mentioned, but they're more gradual too. It's not like they just suddenly appeared. When it tends to just kind of come out suddenly like that, that's when I think about, okay, is there an infection? Is there some kind of depression issue or anxiety issue, something else that's contributing to that? Sometimes if they have the right motivation, then that can not be an ADHD thing as much too, because it could be that they're just bored, right? And so in the case I mentioned of the creative writing class versus the science and math class, if it was just occurring in that instance, then I would call it more of a boredom thing. But if it was, in his case, he was having it at home too, like a lot of those symptoms. So that's what makes it extend past that setting. And leading to that other point is where it's in multiple settings, not just one, but multiple. That's what makes the difference. Like, it's a systemic thing. So what do we do, right, if you suspect this? So the most important thing now is to get an evaluation. So ideally, you want to do it by a psychiatrist because we are the most trained to assess that. You can also get what's called neuropsychological testing, and that will be like a thorough test to do it. But then there's no usually treatment associated with the neuropsych testing. And ADHD is a clinical diagnosis, meaning that you don't have to have neuropsych testing to get the diagnosis for ADHD. So I think that's really important. But if you're unsure about it, then what I would advise you to do is to get a consultation, so that way we can meet, I can assess him, and then make sure that if he does have it, and make sure he can get started on the right treatment too, because it could really change your son's life and your life too if he does have ADHD and we get it treated. So with that, thank you for watching, and I'll see you next time.